Hi, Dr. Sturges here. I wanted to take a minute and go over one of the more common tests that we run in our clinic here with our functional medicine patients. And this test is called an adrenal function test. All right? The adrenal glands are two little glands that sit on top of the kidneys. And the primary responsibility of the adrenal glands is to produce hormones that respond to the different stresses in our life. One of the primary hormones that we're looking for that the adrenal glands produce is the hormone cortisol. Cortisol is the primary hormone that regulates our stress response. And it's very important that we look at this hormone in many of our functional medicine patients because many of our patients are chronically stressed. And this might look like emotional stressors, work, family, physical stressors, a bad low back, an arthritic knee that they've had for years, dietary stressors, maybe a gluten sensitivity or some type of a food allergen, or even chemical or environmental stressors, perhaps in a work environment with different exposures to different chemicals. Over time, these different stressors really beat up on the body, and this cumulative stress response can be directly responsible for a lot of the symptoms that we see patients for, whether it be fatigue, digestive issues, anxiety, depression, hormonal imbalances. A lot of these, if we dig deep, can be the long-term results of this chronic stress exposure. So when we look at the adrenal function test, we're really looking at two main things that we're looking to find. One, we're going to test to see what the actual levels of cortisol are 4 times throughout the day. So we're going to have the patient test in the morning, we're going to have the patient test at lunchtime, and maybe at dinner time, and then in evening time. And that lets us know what those levels are at various times throughout the day. The other thing that we're going to look for is to see how these levels cycle throughout the day. In a perfect world, cortisol levels are very high in the morning when we wake up. We wake up energized, motivated, ready to tackle the goals for the day. As the day progresses, cortisol levels then drop until they're at their lowest points in the evening. That allows us to then lay our head down on the pillow and fall asleep comfortably and get a good night's sleep. Many patients that we see might wake with low levels of cortisol, and these patients are fatigued. They don't have the drive to get up and get going in the morning. Likewise, or on the flip side, we might see patients with very elevated evening levels of cortisol. And this is a problem because these are the patients that can't seem to fall asleep. They lay down at night and their mind is racing. What do they have to do tomorrow, next week, the next month? They're not getting that good, restful night's sleep that's so important. So what we do with all this information is allows us to develop specific programs to correct for them. That patient with low morning levels of cortisol, we develop a program that raises that up so they can wake up again with the energy that they're looking for. That patient with maybe elevated levels of cortisol in the evening, we drop the level down. Again, to allow them to get a restful night's sleep. Sleep is key. You got to get your 8 hours a night at least. So with all this information, again, it develops or allows us to develop these specific programs for our patients. So if this is something that you think would interest you, just go ahead and give us a call here at the clinic. We'll be happy to discuss it with you. Thank you.